Hello, everyone. We are so glad to have you here with us today. We are going to have a webinar on managing mitral valve regurgitation. And this is a patient panel, so you have the wonderful honor of hearing from people who have experienced it firsthand, and there is no expert like that. I am Jody Smith. I'm the program director for the Mended Hearts Inc. And I also have on with me today Mandy Sandcooler, who is our communications and field services director from the staff here at Mended Hearts. And I'll introduce our panel to you in just a minute. But first of all, some things for you to know. So some of the things that you want to know for this webinar are, first of all, every attendee is in listen-only mode. That means you will not be able to speak during this webinar. However, we would really appreciate your questions for any of the panelists. And if you can see the box that's entitled Q&A at the bottom of your screen, if you click on that, you can type in your questions and we will try to get to as many questions as possible. Questions about your specific condition or treatment cannot be answered on this webinar. However, they may only be answered by your treating physician, but we'll try to answer your questions to the best of our abilities. I also want you to know that this webinar is being recorded and will be available on the Mended Hearts Inc. website. That's www.mendedhearts.org, and on our YouTube channel as well. So I want to now take the time to thank very much our partner in this. This webinar is brought to you by the Mended Hearts Inc. in partnership with Abbott. And this is one part of a two-part patient education series featuring leading providers as well as patients who have experienced mitral valve regurgitation. The second part, part two, is coming up later this month. And that is, what is mitral valve regurgitation and how is it managed? This webinar will feature Dr. Paul Mahoney, co-director at UPMC Heart and Vascular Institute Structural Heart Program. I'll give you a little bit more information on that part two at the end because I know you're not going to want to miss it. So now I have the pleasure of introducing our absolutely wonderful panel. And we have the privilege of having an excellent moderator here with you today, Kim Gibbon, and she is a valve coordinator. We also have three patients, and the first one I'll introduce is Carol, and Carol is going to be sharing some of her story with you today, and this is Carol's quote. If it wasn't for the MitraClip, I wouldn't be vacationing here in the beautiful city of San Francisco, enjoying the famous clam chowder in a sourdough bowl. That sounds delicious, Carol. I would like to be doing that myself. We also have Ed, and his quote is, I've always been very active in my life, playing full court basketball until I was 75 and golfing into my 80s. But the day before I received the MitraClip, I felt so bad that I could not even take the trash out. The morning after the implant, I was able to walk around the hospital twice without breathing hard. I felt 100% better. It was like a miracle. And then we have Gary. Gary says, I've been volunteering in the kindergarten and in first grade at the local elementary school for 18 years. It's kept me young at heart and humble. I thought I may have to give it up, but after this procedure, I think I may go another 10 years. Well, I hope you at least go another 10 years with that, Gary. What a gift to those children. And now I'm going to turn it over to Kim Gibbon, who's going to talk to you a little bit about mitral valve regurgitation, and she's going to moderate our panel.
Thank you very much. Thanks, Jody. Hello, everyone. And first of all, thank you for joining us today. So I'm Kim Gibbon. I'm a nurse practitioner, and I've been working with valve patients for over 20 years. And today we're here to talk about mitral valve regurgitation. So mitral valve regurgitation is the most prevalent valvular heart disease in the world. It occurs in more than 200,000 cases per year, and roughly that evens out to about a little more than 1 in 10 per person, for every 10 patients. It occurs when the valve leaks. So what does that mean? The mitral valve is one of 4 valves in the heart. Normally, the blood leaves the upper chamber of the heart through the mitral valve. It goes to the lower chamber of the heart. The valve then closes behind it, encouraging the blood to keep moving forward out to the rest of the body. Mitral valve regurgitation is when this valve fails to close properly, and the blood leaks out backwards with every pump of the heart, or leaking. What this can do is this can back up and increase the pressures in the lungs, called pulmonary hypertension. It can contribute to irregular heartbeat, called atrial fibrillation, as well as congestive heart failure. Symptoms include shortness of breath, perhaps some chest discomfort, dizziness, swelling of the ankles, and overall fatigue. Now, the treatment options, first of all, the most important is the medications. Guideline-directed medical therapy, or GDMT, as you may hear it called, is a select group of medications that are proven to improve and protect the valve and heart function. For a select few patients, the next step might be a mitral valve repair or replacement. This can be done, the mitral valve repair replacement, through open heart surgery the traditional way. Another option is the less invasive transcatheter edge-to-edge repair or clipping of the mitral valve to fix that mitral valve regurgitation. It's important to have these discussions with your healthcare provider, but as mentioned here, even more important is hearing from the folks who have lived it. So we have 3 wonderful patients today willing to share their stories of how they got from diagnosis to treatment to success. Eddie, how about we start with you?
You bet.
Go right ahead, Eddie. We're eager to hear more about you.
Oh, okay. Well, I'm here. I'm excited. I'm thrilled. I'm very, very hoping that I can make a difference in somebody's life. And the mitral valve clip has just been a huge change in my life. Like you said earlier, I was having tremendous problems just being tired and couldn't even take out the trash. And I met a gentleman at church, actually. He was a doctor, a heart doctor. And I had a cup of coffee with him, and I said, I've been feeling kind of bad. He says, well, you could have atrial fibrillation. Stop by my office. He listened. He says, I think you've got mitral valve regurgitation, and we can fix it. I said, thank God, because I'm not ready to spend my life in a wheelchair or sucking down oxygen or drooling. You know, I want to be active. I want to have fun. And so I went in, and he introduced me to the surgeon, was Dr. Ng, and they said I was a perfect candidate for it. So I went in the hospital. They put a line up my groin, and oh my God, the next morning when I woke up, I just was itching to get out of that bed. And I asked the nurse, so she called the doctor, and he said, well, sure. So she and I walked around the entire hospital, and I didn't even breathe hard. And I said, I want to do it again. And she said, well, you're on your own. You don't need me. And so it just worked out fabulous that I'm back to doing the things I used to do. So it's a miracle. And I told Rebecca, hey, anything I can help, you give back. What goes around comes around. You guys literally saved my life. And I'm back having fun again. Just got back from 3-week vacation at Mission Beach, and back to the heat here in Phoenix, Arizona. That I had a great time and feeling really, really, really good.
That's a wonderful story. Thank you, Eddie. Gary, let's hear a little bit more about you.
Okay. Well, it was in the probably early spring of 2022, and I was just getting more and more tired and fatigued. Just didn't have any energy, and and I just thought things had been slowing down because of the COVID lockdown, and so I just thought, well, I'd been sitting around too much in the chair and not doing enough exercise. And I thought, well, I'm just getting older and lazier. And but it just kept getting worse and worse. And to the point that on Memorial Day weekend of 2022, I was in just such a funky state. I mean, I couldn't think, I couldn't function, I could hardly move. And so I went to the emergency room and was after they did some checking, they said, well, you've got pneumonia, which surprised me because I hadn't been doing any coughing. I didn't even know I had a temperature. It was just total fatigue. And then I did a little more checking and said, well, you've got AFib. And here again, that was a shock to me because I'd had no clue. You know, I'd been on a low dose of potassium, about 12.5 mgs for about 4 or 5 years, but you know, blood pressure issue, but nothing bad. I didn't feel it, never felt it. And they said, well, you've got AFib and you've got regurgitation, and we think you have sleep apnea. And all of this came as a shock to me because here again, I'm like Eddie. I was doing anything I wanted to, skiing and mowing the yard, playing a little basketball, and but this totally shut me down. So they sent me up an appointment at a radiologist in Durango, which is about an hour away. And after doing some more checking, they lined me up with Dr. Kim in Colorado Springs. And on Labor Day weekend, actually a year ago, this past weekend, I checked in there, and they went up both groins. But they told me that if I'd been younger, I'm going to be 85 in about a month, and they told me if I was younger, they would have done open heart surgery. But they felt this was the best procedure. But so they went up both groins, put on those clips. I was supposed to be in there at least 2 days, 2 nights. I got after the surgery or the procedure. I felt wonderful. I never did have any pain, never had any pain before, never had any pain after the surgery, nothing. I'm like Eddie, I was able to walk around, had a good meal at first night, and they checked me out the second day and told me to stay around in Colorado Springs and in case there was more, bleeding or something. But I never had any bleeding, and so they let me drive home. It was about a 4.5 hour drive. I drove home myself and never had any problem at all. I'm back volunteering in elementary school. Just got back from that a few hours ago and feeling great, playing golf. And I'm still on some medication, but not as much as I was before. And I think that's just to kind of maintain things. So here, and like Eddie, it was a miracle. Feeling good. Just getting older.
That's great. So nice to hear that you were able to go right on back home. And I'm sure those elementary school kids were so excited to see you. Carol, please share a little bit about your story.
Well, I have some similarities with both Eddie and Gary in that about 7 years ago, I started feeling very tired and I was a little short of breath and finally decided to go see a doctor. And they did diagnose me with mitral regurgitation. At the time, it wasn't bad enough to do anything about it. And then through the 7 years, things got a little worse. And I finally ended up going to my 5th cardiologist, which was Dr. Ramahan here in California at El Camino Hospital. And he thought I was a good candidate for the mitral valve clip. I guess there is a window of opportunity. And I finally got sick enough for it. And he was going to do it, but the pre-test showed something was wrong. And although the procedure was scheduled, he canceled it. And I had another big problem that had to be solved for the next year. So during that next year, my breathing became even more labored. I always felt like I couldn't get enough breath. And finally, they decided to try to send me back to Dr. Ramahan. And even though I had this additional heart problem, they asked him if he would consider working with me, and he said he would. And he did the mitral valve clip, and the very next day, I was able to breathe again. It felt miraculous. My daughter came to the hospital, and we were so happy we actually danced in the hospital room. And when I think back on it, that was probably not a very good idea, just having had the procedure, but you know, that's how good I felt. And to this day, I can still breathe properly.
That's wonderful. And I think that was the best idea, dancing with your daughter. So we heard a little bit of everyone's story. Let's dive a little bit deeper. Early on, we talked about the guideline-directed medical therapy, or GDMT. So again, this is a group of medications that have been proven to protect the heart muscle and also improve the heart muscle. Gary, you touched on that a little bit, about how you were on first very little medications and then ended up on some more. Can you share a little bit more about that with us?
Yeah. Okay. I had never been on any medication. I hardly ever took an aspirin, no pain medication, anything for really pretty much all my life. But it was about 5 years ago that my blood pressure started creeping up a little bit. And as I said, they gave me about 12.5 ounces of potassium. And I was on that for about 5 years, but no other medication until after my diagnosis, with the AFib and the regurgitation. And then they put me on some medication there that to again take care of blood clotting and the pressure and all that stuff. And I was on a pretty heavy dose of those medications. I'm off. In fact, my blood pressure's gotten so low, I'm off the potassium totally today. I'm not taking any more of the potassium, even though it's a small dose. And one of the medications, they cut it in half. And the other one that's used primarily for AFib and to avoid stroke and that type of thing, it's only 20 mgs of that. So I'm just on the two medications, 20 mgs of one and 25 on the other. And, I still have a little bit of tiredness, but at 85, it's not bad at all. I can do pretty much what I want to, just can't do it as long.
Wonderful. So as you mentioned, the physicians or your healthcare provider will most likely start some of these medications, and that, along with the MitraClip procedure, can improve the overall heart and valve function. Now, Carol, I noticed in your story, it seemed a little bit of a longer path than the other two. And oftentimes this happens for people where they have more than one issue going on, and there might be a couple of side streets to that road to wellness. Can you share a little bit more about your experience?
Yes, well, it took Dr. Ramahan to diagnose when he was about to do the first procedure. He saw something in the test results, and he completely canceled the procedure, which broke my heart. And he sent me for a heart biopsy. That biopsy showed that I have a rare heart disease called cardiac amyloidosis. And just a quick explanation, it's a rogue protein that developed in my bone marrow, transferred into my blood, and then it attacked my heart and probably a couple of other things too. But bottom line is, the procedure was canceled, and I proceeded with chemotherapy, which is the only known treatment for this disease. And throughout it, they finally at one point got me in remission. I'm not any longer, but I was for a while. And during that time, I was still unable to breathe. I mean, I felt like every day I couldn't get enough air in my lungs. And they didn't know if it was because I was having panic attacks and then couldn't breathe, or whether I couldn't breathe and then was having panic attacks. And I knew in my heart I couldn't breathe. And yes, then I was having panic attacks, but I didn't want to stop treatment. They wanted me to go on certain drugs to help me relax. And I just said to myself, Carol, if you're doing this to yourself, you've got to do what they're saying. And I went on the drugs, and yes, they did relax me, but I still couldn't breathe. So after almost an entire year of struggling with this, they decided to reach back to Dr. Ramahan and see if he would be willing to work with a patient with this disease. And he was. And I finally received my mitral valve clip. And, you know, although I'm dealing with the disease still, I can breathe. That's all I care about.
I'm so happy for you. And it sounds like it was a very long and sometimes discouraging pathway for you, but it's encouraging to hear that you could still have the procedure despite having other issues going on.
Yes.
Another thing that I think that we learned from your story and the others is the importance of having a very strong care team, including yourself, as you'll be participating in your own care, supportive family members or friends, but also the healthcare team. And Eddie, you mentioned almost jokingly about how much you loved your healthcare team. Can you share with us a little bit about how important that was for your care?
Oh my God, yeah, psychologically, physically, everything. I got tremendous encouragement. And after they ran a bunch of tests, they came in with a big smile and says, you know, you're the perfect candidate. And I was thrilled with Dr. James Kenneller is his name. And he just did an absolute fabulous job, the follow through. I still see him at church, among other places. And he's always asking, how you doing? How you doing? And I found my doctors really, really, really cared. And that makes a big difference to me.
Excellent. And I think it's important for everyone to be involved in their care for sure. You know, just to review, we talked about the symptoms of severe mitral regurgitation, and there can be a spectrum of them. I think we heard symptoms such as Gary's, where he was suddenly very sick and in the emergency room. But other times the symptoms can be mild, such as, am I just getting older? I think I'm more tired. So wondering if you could please share your symptoms beforehand and now how you're feeling. Eddie, how about telling us a little bit more? You were mentioning how much better you felt after your procedure. How did you feel before?
Well, before they did it, I mean, literally, I couldn't take the garbage out. If I'd walk more than 20, 30 feet, I'd be panting. And I thought it might just that I'm getting old, but I didn't succumb to that thought process. And I fought it, and I went to see the best heart doctors in Arizona, and they did a fabulous job. So yeah, and it was a matter of, it wasn't pain, it was just tiredness, and I'd get exhausted, and I wasn't being able to think as straight as I had before, because I work with my brain, not my back, and it's important that I have good thought process. And since then, it's been terrific.
Great. And Gary, we touched on your story. Perhaps you could share a little bit more about your symptoms then and now.
Yeah, I can relate with Eddie on that. You know, couldn't function, couldn't think, that because that was the only symptom I had before the surgery. Like I said before, it all came as a total shock to me because I wasn't coughing. I couldn't feel, you know, some people can feel, I guess, the irregular heartbeat, the palpitations. I couldn't feel, I can't even feel my heart today. I can't even feel it. I never felt any of that, had no symptoms whatsoever. And that's why it came such a shock. And I thought, well, maybe I had COVID, but they checked. No, I'd had the COVID, 2 of the vaccines, you know, about 6 months before this. And I even thought, well, maybe that was a factor, but there was no indication of any COVID, no pain, no, it just exhaustion and not being able to function physically or mentally. And, you know, that was it. You know.
That sounds very frustrating in the beginning. So I am so glad you're feeling better since the procedure.
It was.
And Carol, how about you? Please tell us a little more.
Yes, well, it's all mixed in with the chemotherapy too, because that brought me to my knees. But during that whole time, I was suffering with this, not being able to breathe properly. And at one point I couldn't walk and talk at the same time. That's how weak I was. And I really thought, well, this is the end, I'm heading out. And after the procedure, I have to tell you, I could do things that I just never thought I would be able to do again. And they seem sort of mundane, and I know I took them for granted, but I am so happy to tell you that I can go grocery shopping and carrying in my own bags. I can change my bed without having to fall into it afterwards. I can have a conversation like this without being out of breath. It's just, for me, it was a game changer.
I think we can see that, and I'm happy for you. That's wonderful. I think as we hear and in the audience listen to these stories, there may be many similarities. I've been feeling like that, or my loved one has been feeling like that, but also many differences. So again, it's important to identify that you're not feeling right, or that you have a change in your breathing or any of the symptoms that were mentioned, and to talk to your healthcare provider, learn a little bit more. Anyone who has a murmur should definitely follow up with their doctor, with their healthcare provider, to look into things a little bit more deeply. We've heard some very interesting stories up to this point, in many ways very similar, with having the successful procedure that led them to the happy, healthy, and active folks they are today, from what was once a very challenging situation, whether it be difficulty breathing, difficulty thinking, or not being able to do what you want. I'm wondering if each of you wouldn't mind taking a few moments to talk to the folks out there. What kind of advice would you give to them or to their loved ones in regards to the experience that you've had and what you might recommend to someone else? I think, Eddie, if you wouldn't mind starting again.
Oh, yeah, sure, I'd be happy to. I have such an unremarkable life in that I went like 60 years with never missing a day of school, never missing a day of work, never missing a basketball game. And so I just pretty much took my health for granted. All my friends were having high blood pressure and hemorrhoids, and I never caught a cold. I never had the flu. I never had nothing. And then all of a sudden I started getting real tired. And in the past, I had always believed in the physician, heal thyself. And, if you take care of it, it'll go away before too long. But this lack of stamina didn't go away. And so when I met this doctor, and Dr. Kneller, and he said, well, come on in and take a look. I'm thinking, oh, I'm just wasting his time. But, he seems like a nice guy. So sure enough, I went in. They took some x-rays and things and showed that I did have this. And then they figured they could cure it. So I said, well, let's go for it. And boom, Katie barred the door. It changed my life. So my advice would be to get good medical consultation, find a really, really good doctor, and then listen to him and do what he says.
Thank you. Thank you. All of those points, very important. And Gary, your experience, what would you offer to others?
Well, I'm a little bit like Eddie. I rarely went to a doctor unless it was for a broken bone or something like that, which didn't happen very often, thankfully. Occasional sinus infection, had some sinus issues and off and on, just a matter of getting going in and get an antibiotic, and 5 days later it'd be over. And like I said before, I didn't have any, I didn't even know what a heart murmur was or what it felt like, because I never felt anything like that, or an irregular heartbeat. I know some people can feel that. So this had to have been coming on over the years. And so I guess my advice would be, at least when you start getting up there, maybe even earlier, but at least, around 60, 65, something like that, you probably ought to start having annual checkups. I never did do any of that. I never had any annual checkups. I just went when something was really bothering me, which wasn't very often. So I guess my advice would be have regular checkups so they can catch it early. I don't know if it made any difference in my situation, but it probably would have helped because they probably could have got me on some medication quicker and maybe even have avoided the procedure that I went through. So just regular checkups would be my advice.
Thank you. I can see that there's been a big change for you to where I think now you are actively involved in your own care, being an advocate for yourself. And I think a reminder to others that it's important to start building that healthcare team early on. How would you say your participation in your own healthcare has changed since this diagnosis?
I check my blood pressure fairly regularly. I am faithful to take the medication that I'm on now, the reduced dosage. And I'm in the cardiologist out of Durango, the hospital there. I'm on regular seeing them about every 6 months, or that's the schedule. You know, that's about it. I'm just more alert to different symptoms now.
And feeling well enough to do all of those things, it sounds like. Yeah.
Yep, I am.
And Carol, through your wealth of experience and many experiences over the year that you went through your pathway, what would you be able to share with others? What advice would you be able to give?
Yeah, I agree with many of the things that Gary and Eddie just said. I do think it's important to at least get an annual checkup. But when you start feeling something change, don't say it's old age. Go find out. Go to your doctor, get the tests, just do it and find out. And something I forgot to mention, which is important, I think, is after my mitral valve clip, they had a wonderful program at El Camino Hospital for cardiac rehab. And once I got over the surgery, which was, you know, I had to get strong enough again, like maybe 4 weeks, I went to their cardiac rehab and I went to 36 sessions. And by the end of those sessions, I was walking on the treadmill 2 miles at 3 miles per hour at a 5 elevation. And that is what got me grocery shopping and changing my bed.
Oh my gosh. So that's very interesting. So you attended cardiac rehab.
Yes.
And that's an opportunity that we often aren't aware of, that anybody who's had a valve procedure, a clip, is eligible to attend cardiac rehab. And I'll bet from speaking to so many patients, you probably also enjoyed the folks that were there, other folks like yourself, who may have had similar experiences. So thank you for sharing that. Is there anything else that anyone might like to add? I think that you've all had some amazing experiences. I'm glad that you're all feeling well. Eddie, I think you mentioned you were just on the beach a couple of weeks ago.
Oh, it was fantastic. Yeah. It was 19 here in Phoenix, and it was 70 in San Diego. So living the dream.
My goodness, my goodness. And Gary, are you able to keep up with those elementary kids?
No, like I said, it's about 12 hours a week. You know, it's kindergarten and first grade, and they keep me busy, but they also keep me humble and keep me young. So yeah, it's been great. I think I can do it another 5 years at least now.
I'm sure. And Carol, all of that shopping, I suspect you're able to get out more now with friends or family.
Yes, I am. I have to be very careful because I'm immune suppressed. So I'm still sort of in pandemic mode. But yeah, I mean, we go to safe places, either eat outdoors or we bring meals in here. You know, this affects your whole family. They all have to be very careful and test before they come to see me and all of that. But yeah, I mean, like I said, I'm very, very grateful for this procedure and what it's done for my quality of life.
Wonderful, wonderful. Well, fortunately, I think we do have some time here. I think that what you've all have shared, and thank you for sharing such personal stories. And it's very encouraging to hear the successes that you've had, and that for everybody, there may be a journey for them that's a little bit different, but can still get you to feeling where you want to be. Maybe going from, I think I'm getting old, to I'm doing things now that I never thought I'd be doing again. So thank you all for sharing that. Fortunately, we do have some time for some questions and answers that we can provide for the audience. I don't know if anyone in the audience has any questions. Please just put them into the chat room, and we're happy to share any information or experiences that we can.
So yes, I'll go ahead and read some of the questions in the Q&A if that's okay. Kim, I think this first question is probably more for you actually. And Bob's asking about the difference between the mitral clip and then TAVR. We hear that a lot. So if you could explain the difference.
Yes, excellent question, because we do hear about both of them. They treat different valves. So the TAVR treats the aortic valve for a narrowed aortic valve or aortic stenosis. The mitral clip treats the mitral valve for the leakiness, the mitral regurgitation. So excellent question. Two different devices that treat with the indication to treat different valves.
Yeah, if I can interrupt here just a second, is that okay? Okay. They did my mitral valves, but they also did something with my tricuspid valve, and they worked on that also. So I don't know what the distinction is, but it was the mitral valves and the tricuspid valves. They worked on all those going up through the groin with these clips.
Yeah, that's very, very interesting. And I think now we're starting to learn a little bit more about the other valves, including the tricuspid valve. And for that reason, it's very important to go to a heart valve center that specializes in all of the therapies so that you have all of the therapies and treatments to choose from to find what's best for you. Excellent point.
Okay.
Thank you. This next attendee says that he or she's been told they have a mild mitral valve regurgitation, which is not of concern right now. But he or she's wondering if a mild regurgitation can transition quickly to a higher level that needs to be addressed.
Another good question. Now, of course, I've never met you and I haven't seen any of your imaging, so I would have to defer the specifics to your healthcare provider. But oftentimes the mild mitral regurgitation, that mild leakiness, can be helped with the appropriate medications as we talked about earlier. And then it's important to have continual follow-up. They might want to do another echocardiogram once a year, every 6 months, every other year, depending upon your case, and your healthcare provider. And you want to be aware of those symptoms, as Carol, Gary, and Eddie said, that if you note a change in your breathing, or swelling of the ankles, or you're more tired, or you're having chest pressure, then you want to bring that to the attention of your healthcare providers so they can keep up and double check and make sure that you're still doing well, or if they need to adjust your therapy or consider some other treatment options.
Thanks, Kim. Bob has had his mitral valve replaced through open heart surgery 6 years ago with a cow valve. And he's wondering, are there any statistics on how long those valves last?
So I think that that's a very common question and a very good question. I don't want to claim to be a science expert, but from the data that we do have, any of these tissue valves where the leaflets themselves are made of tissue generally last from 10 to 20 years. That's the average. That varies very widely amongst folks. And again, I don't want to claim to be the expert or throw any numbers out there without having the evidence in front of me to back it up. But it's a good question, and they are tissue valves. So they do wear out over time, hopefully 20 or 25 years, but maybe sooner. It's a good question for your surgeon as well.
Thank you. Andrea asks, did any of the panelists, and Gary, you did say you had a tricuspid valve repaired also, but have any of the other panelists had any other valves? Have they experienced regurgitation or repair with their other valves?
I have not.
No.
Okay. Thank you. Thank you.
So that's not unusual. There are folks that have more than one valve, polyvalvular or multivalvular disease. That's not unusual. So again, speaking with your healthcare provider and learning a little bit more about how that affects you.
To the panelists again, is there any pain before or during or after the procedure?
For myself, there was no pain before, there was no pain, when they put me on the table for the procedure, there was no pain afterwards. I didn't even have any pain in my groin, a little discoloration, little oozing, but not even really any bleeding, and I have never had any pain from this before or after. I told the doctor, when he came in to see me right after after I woke up from the procedure, that I said it was a piece of cake. And he probably thought, well, it wasn't a piece of cake for him, but it was a piece of cake for me.
My experience was the same, although I was dealing with my other problem and the chemo didn't help, but I didn't have any pain before or after. It was very, very simple procedure that really worked. My doctor even said he feels like it's a very safe procedure because if it doesn't work, there's no harm, no foul. That's how he told it to me.
Eddie, anything to add? I believe you had already shared your experience. I think Eddie mentioned earlier when he was in the hospital that he too didn't have any pain, didn't experience any pain.
Right.
I do have a question. I think this is really a good one. If you have a loved one who is struggling with being tired and not, some of the symptoms that you all experienced, how do you convince that loved one to go and see a cardiologist?
Boy.
Well, I think that would be tough with me and my husband because he's pretty stubborn. He's got such good health. He's reluctant sometimes to go to doctors, but I think you just have to present them with what you're seeing they're slowing down, saying that they weren't able to do what they used to do, and just keep telling them that they need to go get checked. I don't know. It's a hard one when you have a stubborn husband.
I can relate to that. I think my approach would be, what do you got to lose? Most of it's going to be taken care of by your some insurance or Medicare or something. What, might as well go ahead and do it. You got nothing to lose, and if you don't, it may be too late someday. So I think it's just a matter of just go do it. Bite the bullet, go do it.
Yeah, I think that's a very difficult situation for a loved one, a family member, a spouse, when you care so much about a person, but it's hard to convince them to seek help. Oftentimes, your primary care can help you with this, knowing you, your family, your patient as well. And it's important to accompany the person to any visits they might have. Sometimes people downplay their symptoms. Oh, I'm all right. I'm just getting old. When you, the one who's watched them over the course of months or years, can say, no, I see a difference. I see them slowing down. I see you winded when we go for our walks where before you weren't. So I think it's important to help become engaged in their care, and also to encourage them to ask questions.
They're all great ideas. Is there any, to the panelists, is there a sensation or a feeling, like, can you feel the mitral valve clip at all, or is?
Speaking for myself, I feel nothing. No, I can't feel anything. No, nothing. It's same as it was 40 years ago, 20 years ago. Just, I don't feel anything. No pain, no palpation, nothing like that. It's just nothing.
I'm the same. I don't feel anything at all, and never have.
Yeah.
Great. Another question from Jeff. He had open heart surgery back in 2015 to correct the problem. He says he's in wonderful health to date, but should another problem ever happen again, could it be corrected with the clip?
So I think that I'd have to go with I don't know, and only because there's so many variables. So yes, they could very likely be corrected with the clip, but that would depend on what your problem was, and what your options were, and actually needing to know a bigger story. But what I would say is that's an excellent question. It's important to continue to follow up with your doctors and your cardiologists, and to continue to ask questions like this. Notice if your symptoms change, and ask, is this something that might be able to help me? Would the mitral clip help me with my mitral valve if that is my problem? So excellent question.
Thank you. To the panelists, I guess this is a two-part question. What does follow-up care look like after the procedure? And then are you on any medications that went along with the procedure that remained after?
Yeah, my what they told me was at least for this first year was get a 6 months checkup, you know, from the cardiologist, and by my second 6 months was in fact I just went to the cardiologist 2 days ago, and they said they want me to do some blood tests just to make sure things are, you know, looking good. No change, everything looks good, blood pressure is fine, and I'm scheduled to go back 6 months and probably have an echocardiogram at that time, but that's the only follow-up. And like I said before, the medication, I've actually dropped one of the three, the potassium, and so I'm just on it's another blood thinner and blood pressure, and one that helps prevent, you know, strokes, that type of thing. But that's one's 25 mg, the other's 20, and that's it. And I'll probably be, you know, they said I'll be on that at least, you know, for the distant future, just more for regulation than anything, I think.
And my situation is I was not put on any particular drugs because of the mitral valve, but because of my other heart problem, I am on about 3 or 4 drugs. Some of them are diuretics, just to make sure that if I, you know, feel, if I see a lot of swelling going on in my legs, or if I feel like, well, they make me watch my weight daily. I have to weigh myself daily. If I go up 2 pounds, I increase diuretics, because I could end up in the ER. And I had several times before the mitral valve clip been in the ER because I couldn't breathe and because I had so much fluid buildup in my lungs. I haven't been there to the ER since my mitral valve clip. And most of the medications, like I said, are for my other problem.
So in general, folks that have the MitraClip procedure, they're discharged the next day or the day after, depending on how you're doing. And we ask that they come back at a month just to see how you're doing, but also to do another ultrasound of the heart, the echocardiogram of the heart, to confirm that everything is all right. Your cardiologist might also want to see you sooner. Everybody's a little bit different. In addition, we like to have you come back at 1 year for the same reason. Let's do an ultrasound of the heart, let's do an echocardiogram, and let's confirm that everything is still doing very well. Everybody's a little bit different, and a lot of that depends on whether this is the only challenge you're facing or if you have multiple challenges that you're facing. And so we would defer to your own primary care or cardiologist to see if you need to be seen more frequently. But in general, folks are seen by their own cardiologist a week to 2 weeks after the procedure, see us, the care team, back at 1 month and at 1 year, with all of the management in between being done by the primary cardiologist. As far as medications, generally folks are placed on an antiplatelet of some sort, such as a baby aspirin or clopidogrel for a period of time, unless they're already on blood thinners. But specific for this procedure, no true blood thinner is required. So no warfarin, no rivaroxaban, no apixaban, no true blood thinner is required. You may already be on it for something else, but it's not specific to this procedure.
That's great. Thank you. In terms of who does the diagnosis and what type of cardiologist does the procedure, did all the panelists see a general cardiologist to get this done, or did you see a specialist of some type?
I saw a specialist. He is a cardiologist, however, but he does specialize. Dr. Ramahan specializes in this procedure, and he's done thousands of them, I guess. And he's very good at it. He's very skilled.
Yeah, mine was a specialist too. There's actually 2 of them. The one, frankly, I can't. He did a lot of open heart surgery, and I think he was there more for assistant. And like I say, the Dr. Kim was a specialist doing this type of procedure with the clips. I can't tell you what their correct title would be, but they were both specialists.
Oftentimes, the pathway is either the patient or yourself might already have a cardiologist or have a primary care physician or healthcare provider that refers you to a cardiologist. The cardiologist makes this assessment, the diagnosis, and then oftentimes we'll send you to a heart valve center to learn more about what your treatment options are, where you'll meet an interventional cardiologist. And this is a cardiologist who specializes in transcatheter therapy and using the catheters and tubes to place this device.
Thank you. Anita is asking about cardiac rehab and about feeling energy initially after having the mitral clip done, which I know some of you talked about, but then that energy kind of dying off again a bit. And so even with cardiac rehab, still the same issue. So did either of you feel a lack of energy in the weeks after?
Well, I was dealing with so many things because chemo does take a lot out of you. But all I can say is I worked through it. And cardiac rehab, they start you out very slowly. They have a heart monitor on you the whole time you're working out. They stop you if they see something going on that looks funny. They train you on different machines. I was even lifting weights twice a week with them. It was a fabulous program, and I can't recommend it enough. If you're having a mitral valve clip being placed, ask about their cardiac rehab. And I had to wait a while to start because of all my other conditions. I had to wait about 4 weeks, I think it was, before they would take me. But once they took me, it was 36 straight sessions, and it was a game changer.
I didn't go through the cardiac rehab. They recommended it, but the problem is I've got a 60-mile drive to go to it, and I just didn't want to go that route. But I haven't really noticed that much change in my ability to do things. I think it was about 9 days after this procedure, I played 18 holes of golf. Now I was tired, and I didn't I sat in the cart a lot, but I really had no problems. And, I just kept exercising, doing some walking, walk the dog and that type of thing. But I haven't noticed any increase or decrease in it since I'll call it the surgery or the procedure, whatever.
The recommendation is for anybody who's had a heart event to attend cardiac rehab. And the data shows that it significantly reduces the incidence of another cardiac event or of death. So if you are able, and if it's feasible, if it's reasonable and feasible, we strongly encourage that you do participate in cardiac rehab, but recognizing that it's not feasible for all. Well, I want to thank you all for joining us. This has been incredibly insightful to hear all of these experiences, and then to have the opportunity to really get to talk to the folks on the front line. You can talk to your healthcare provider, but there is no information more valuable than that coming from the folks who have walked the walk and who have lived the experience. So we very much want to thank all of you, the audience, for participating, and certainly for participating in the question and answer period. Those questions were spot on. Those were excellent questions. We encourage you to join us for the part 2 of mitral regurgitation, talking a little bit more about the disease and how to manage it. And also, I want to encourage you to talk to each other, talk to your friends and family, talk to your healthcare provider. Is there someone that matches this picture that you're hearing about today? Is there a way that you can take your friend, family member, or yourself from feeling I'm getting old to I'm feeling better than I have in a long time? And I'd like to end with a story from Carol. Carol, please do share.
Well, approximately, I guess it was sometime last year, I had the opportunity to meet Dr. Fred Sangor, who is the inventor of the mitral valve clip system. And he whispered in my ear that Elizabeth Taylor said that her mitral valve clip was the most precious jewel that she owned. And I thought, wow, here I am at age 78, and I have something in common with Elizabeth Taylor besides our beauty.
Thank you all so much. And Kim, you did such a fabulous job moderating the panel, but your stories were amazing. You gave us so much great information, and we really appreciate all of you being on this today and helping people truly understand the patient perspective. And for all of you who were on today and attendees, you guys asked really great questions, and we appreciate your time. And again, there will be a recording of this so you can share it with others and for the people who weren't able to get on it today. We hope you guys have a wonderful evening, and thank you so much again. Bye, everyone.
Thank you.
Thank you. Goodbye.
Bye.
Bye.